Good morning. I appreciate having the opportunity to speak to all of you today and to address you about the dangerous proposal that Initiative 65 puts before us. My name is Dr. Jennifer Bryan, and I'm a family physician. I'm a mother of two 9-year-old twin girls and a 7-year-old boy. I practiced family medicine in Mississippi and have for many years, and I'm chairman of the board of the Mississippi State Medical Association. It is the largest physician organization in Mississippi, representing our nearly 5,000 physicians and medical students in the state. Our physicians are tired. We're on the front lines of a pandemic unlike any that has been seen in over 100 years. And yet we have steadily messaged our public to keep them safe. To even attempt to portray our physicians as lacking compassion because we stand up against the dangerous fallacy that is 65 is reprehensible. As a physician, we took an oath to do no harm. You've seen our steady messaging in the pandemic, and at times it's been hard, and we're doing it again when it comes to marijuana. We resent being called prudes or as if we are not with the times when we talk about dangerous public health policy. 65 is dangerous, and 65A is a better way. And the reasons are simple. Enshrining marijuana, giving it the protections in the state constitution, allows us not to ever go back and make any changes. If a town decides that they want to do something different, it's too late. It cannot be reversed. As scientists, we want to research treatments. We want to research compassionate treatments and therapies for our patients. But this is not medicine. Prescribing blunts and gummy bears and brownies and joints every month and having no control over how much or in what form the customer/patient receives it at the pot shop is not medicine, and physicians want no part of it. This is bad public health policy. It's dangerous for Mississippi. It's dangerous for my children and yours. If you want a medical marijuana program, there's a way to go about it. There's a way to research a substance, to look for the therapeutic benefit, and then to provide it as compassionate care for our citizens, which is what physicians stand for. So in closing, I would urge you to vote no to both right now, and then yes to the second portion on the ballot, which is 65A, because 65A is a better way to putting safety guardrails in regards to where these dispensaries could be located with churches and schools and our neighborhoods, as well as making sure that money goes back into our communities if a marijuana program passes and not into the pockets of profiteers. And I'll close again and say that it is no to both and then yes to 65A because physicians are recommending safeguards in place if, and we hope it doesn't, this passes. And that's the bottom two bubbles on your ballot. Thank you for your time and for standing up for Mississippi.
Thank you, Dr. Bryan. Dr. Easterling.
Good morning. Thank you very much. My name is Dr. Randy Easterling, and for the last 40 years I've had the privilege of practicing family medicine, addiction medicine, and addiction psychology in the great state of Mississippi. I'm a past president of the Mississippi Academy of Family Physicians, past president of the Mississippi State Medical Association. I also serve on a select committee from the AMA on a task force to study cannabis to see if there's actually any medicinal value to cannabis. I also served on the Mississippi State Board of Medical Licensure for 12 years. However, I'm not here today representing any of those organizations. I'm here representing the thousands and thousands of Mississippians I've treated in the last 40 years with substance use disorder. I can honestly say that I don't remember a single patient in those 40 years, whether they were addicted to heroin, crack cocaine, crystal meth, benzodiazepines, or whatever, that didn't start with the drug of marijuana. This is the very drug that Initiative 65 will allow to be sold on every street corner in every county, city, and community in the great state of Mississippi. Initiative 65 is a dangerous, reckless, and foolish attempt to place into the Constitution of the state of Mississippi a plant that is classified by the DEA as Schedule 1. That means that it's highly addictive, it's dangerous, and has no known medicinal value. Initiative 65 would put a Schedule 1 drug and make it a legitimate drug into the Constitution of the state of Mississippi. And you need to think about that. This has never been done before. As far as I know, has never been done in any other state. Initiative 65 puts Mississippians in immediate danger. Now, 65A, on the other hand, provides for a more regulated medical marijuana program. It must be based on sound medical advice. The administrating agency shall seek the input of health professionals to help design the program. The program should be limited to qualifying individuals with debilitating medical problems as certified by the medical practitioner. All products must be a suitable pharmaceutical quality and prepared by licensed manufacturers. The program will also have a limited number of state licensed manufacturers. There must be a patient registry. All of these are sound, reasonable steps. For all of the above reasons, but more importantly, for the safety of your family, friends, children, and grandchildren, please vote no on Initiative 65 and vote yes on Initiative 65A. Thank you very much.